All right, thank you very much. I've also noted the good work that's been done by the ministry regarding addressing the opioid crisis. Again, I keep coming back to what I was doing in my previous life, and it was something that I saw a lot of in that job, and sometimes with very tragic results that I had to witness. Now, I was very pleased that the government was able to pass C-37, which did increase the ability of community health groups to make safe consumption sites available, because we know that this is something that would save lives, and the initiatives to making naloxone more available, I think, has been a very important life-saving tool as well. So we undertook a study of the opioid crisis, and we've produced a report that had 38 recommendations. So would you be able to tell the committee what progress you've had in implementing that series of recommendations?
With respect to the work that we've done in the opioid crisis, first of all, as indicated in my opening statements, we recognize as a government and as all Canadians that we're faced with a public health crisis when it comes to the opioid situations. Again, today we've seen some numbers that have been released from Ontario, and the numbers are devastating. We recognize that they're not just numbers. These are people's children, their mothers, their fathers, their personal stories, and the damage that is created by these laws. The collateral damage is huge to families and to communities, so it's certainly an area of priority of mine as Minister of Health. I have to say that the first briefing that I received as Minister of Health was specifically on the opioid crisis, and it's my #1 priority that I'm dealing with on a regular basis, on a daily basis. So as you've indicated, some of the key steps that we've been able to take so far when it comes to Bill C-37, that was certainly an important step in the right direction in order to streamline the application process for the consumption sites that are out there. We certainly need to make sure that we have a harm reduction approach when it comes to dealing with these situations, and we are pleased to see the progress that has been made. When we formed government, we had one of these sites that was available in Canada, and now we have a total of 28 supervised consumption sites that are available. So those are certainly, again, steps in the right direction. Also, when you mentioned about making naloxone more readily available, ensuring that it's a non-prescribed medication certainly allows many individuals to have access to that tool, and that's exactly what it is, something that they need to effectively deal with the situation on the ground. Certain provinces make sure that that is available free of charge, but again, that's a decision that's brought forward by provinces and territories, but we certainly need to do all that we can to ensure that the naloxone product is more readily available. We've also made significant investments as well when it comes to addressing this situation. When the health accords were being negotiated last year, there's a few provinces that indicated that the opioid crisis was an absolute priority in the area that needed to be addressed. So above and beyond the monies that they received for the health transfers, if we look at the province of British Columbia, for example, they received $10 million in direct funding to deal with this crisis on the ground. If we look at the province of Alberta, they received, I believe it was $6 million to deal with it on the ground. And also Manitoba, there was a series of issues, targeted issues that they needed funding for, but opioids was certainly one of those as well that was listed. So they received additional funding as well. And aside from that, we also can't forget that Canadians as a whole have told us that mental health and addictions is absolutely a priority for them. And through our budgets in 2017 and with the healthcare agreements, we recognize that we've made significant investments, $6 billion in the area of mental health. So again, that certainly helps. There's steps in the right direction, but I can't say enough that we recognize that we cannot be complacent when it comes to this crisis. We have to continuously monitor the situation. We have to address the needs that are out there, and we have to be progressive. And also, we can't deal with this alone. There's no one single solution to this, and we recognize that we have to work with provinces and territories and frontline workers. That's going to be key.
All right, thank you very much.